So, welcome to our project for Nutrition 2201. Our topic is cystic fibrosis, and yeah.
So a general overview for cystic fibrosis would be that some key points would be that cystic fibrosis is an inherited disease of the mucus and sweat glands, and cystic fibrosis can affect the lungs, the liver, pancreas, sinus, sex organs, and intestines. Um, that cystic fibrosis can also cause the mucus in to clot inside the lungs, causing you breathing problems and bacteria that can grow inside the lungs. And cystic fibrosis can lead to lung infections, not only bacteria growth. And this will inevitably lead to damage of the lungs. And symptoms can, as well, severity can range depending on your specific case and what your maybe underlying issues might be. Um, you're usually diagnosed through various tests, which include gene, blood, and sweat tests. Unfortunately, there is no cure for cystic fibrosis. So, how does this impact nutrition? The mucus caused by cystic fibrosis can block the absorption of key nutrients and fat that is in the intestines. And this may lead to poor digestion, slow growth, trouble gaining weight, and greasy bowel movements. People with cystic fibrosis may need additional salt, fat soluble vitamins like vitamins A, D, E, and K, calcium, and calories.
Cystic fibrosis has a couple impacts on physical activity. Exercise is very important for someone with cystic fibrosis, but it also has to be monitored starting at a very young age due to the fact that too much physical activity can cause breathing problems, and it can cause an increase of calorie depletion, which is not good for someone with cystic fibrosis. So you always have to monitor what the child's doing, and you should always talk to the doctor about what the child's doing. And whenever your child's exercising, you should always be aware of germs. So hand washing, cleaning equipment, and checking team members' health is very important. But you should always talk with your doctor first if it is okay for your child to do any type of exercise, because it may change depending on the severity of the illness. It's very important to create a plan with your doctor. People with CF have a lot of doctors that they meet with. They usually have a physical therapist that creates a workout routine. The child will go and see them weekly or monthly, depending on how severe their illness is. And then they also have a respiratory therapist. The respiratory therapist will help with breathing exercises, and they'll usually help to fit a child for vest therapy. Vest therapy is very important for someone with CF because they wear the vest daily, and it shakes their lungs and helps break up mucus that they have, so they're not drowning in their own mucus. And medications are very important for a child with CF because you want to stop the mucus buildup, and it's very important to keep a healthy immune system. So common colds could be deadly if you're not monitoring them and medicating your child as it should. Some examples of exercise that somebody may use when they have cystic fibrosis is aerobic exercises like dancing, riding a bike, swimming, anything that can keep the child active and can work their lungs and heart in a positive way. Core strength is also very important for someone with cystic fibrosis. Singing, light exercise, push-ups, they're all good ways to boost that core strength and build it. Yoga is another great example for someone with cystic fibrosis because it's a good way to connect with themselves while stretching their body but not doing too much. The most important thing is to not do too much when you have cystic fibrosis. You don't want to become overworked, because if you become overworked, breathing can be reduced, and that can lead to multiple problems. So you want to pay attention to your child at all times when they are exercising or participating in a sport, and just make sure that they seem normal and that they don't get too overworked.
As with many diseases, cystic fibrosis implications increase with the age of the person affected by the disease. Children with cystic fibrosis suffer from nasal congestion, sinus problems, wheezing, and asthma-like symptoms. As these symptoms progress, older children might experience a chronic cough in addition to some of the previously listed symptoms. As those with cystic fibrosis continue to age, they can encounter implications and complications such as bowel problems, chronic respiratory failure, diabetes. As symptoms progress, older children might experience a chronic cough in addition to some of the previously listed symptoms. As those with cystic fibrosis continue to age, they can encounter implications and complications such as bowel problems, chronic respiratory failure, diabetes, infertility, and liver issues such as liver disease or even liver failure. As new medications and treatments are discovered, the life expectancy of those with cystic fibrosis is becoming longer. In 1962, the life expectancy of these individuals was only 10 years. In 2017, the average life expectancy of a person in the United States with cystic fibrosis was 37.5 years. Many live years or even decades longer. It is also predicted that the life expectancy of babies with cystic fibrosis born in 2018 will be approximately 47 years.
Given the current state of our world, we thought it would be appropriate to include information about cystic fibrosis in relation to COVID-19. There is currently no evidence suggesting that people with cystic fibrosis are at a greater risk of contracting COVID-19. A diagnosis may be more difficult for those with cystic fibrosis because many COVID-19 symptoms are similar to those that they already experience regularly. It has been suggested that people with cystic fibrosis and those around them should take extra precautions in order to avoid contracting the virus. However, the rate of death in those with cystic fibrosis does not appear to be significantly higher than that of the general population. These are our sources, and thank you for watching.